Increasing number of COVID cases is alarming. We have seen patients struggling for ICU beds, oxygen cylinders in the first and the second wave. However, all COVID affected individuals doesn't require hospitalization. Only severe patients needs hospitalization and mild to moderate patients can be treated at home setup itself. If you have COVID-19 or you are caring for a loved ones with COVID-19 at home, here are some guidelines to help you through your difficult time. Hi, I'm Dr. Chaitra. Welcome to my channel Healthy You. If you're watching my video for the first time, don't forget to subscribe and hit on the bell icon for new videos. This is my first video in the series of treating COVID-19 patients at home. Today, let's talk about setting up a proper house isolation for COVID patient. Steps discussed here can be followed either by COVID patients, patients who are reported positive for COVID but don't have any symptoms at all, and people who are taking care of COVID patients. You should start your isolation when you suspect you or your family member are exposed to the infection or when the initial symptoms begin to show. Initial symptoms could be either cold, cough, sore throat, body pain, tiredness, or fever. One may have one or some of the above symptoms in the initial days. If you have any of the symptoms discussed, get yourself tested immediately along with the family members for the infection. Stay isolated till the reports show negative. Start wearing a triple layer surgical mask all the time, even when you are at home. Inform your neighbors and first contact about the positive report and avoid any visitors. Let's talk about patient room and initiating the quarantine. Primarily, COVID patient's room should get lots of fresh air and sunlight. Here are some steps you should follow. Firstly, provide a separate isolation room, preferably with attached bathroom and toilet for hygiene purposes. As soon as the reports show positive, please consult a doctor and do not try self-medication. Keep all the medicines handy for the patient with clear instructions on how to take them. Keep plenty of drinking water, healthy snacks for the patient to help themselves, along with some fruits like apple, sweet lime, orange, banana, etc. Next step is to keep essential things easily accessible for the patient. Few essential things are listed below. You can also add whatever things makes the patient more comfortable during the isolation days as per their lifestyle. Thermometer and pulse oximeter should be kept in the patient room. If the patient is diabetic or hypertensive, they should be regularly monitored either by the patient or the caretaker. Maintain a journal of all the patient readings and share it with the doctor when required. Disposable plates, spoon, glass, bowls should be provided to the patient before handed. Food to be supplied should also be delivered through use and throw food boxes itself. This will limit physical interaction with the patient and contamination of the vessels. Steamer, thermos flask, sanitizer, surface disinfectant should be kept in the patient room itself. You can also provide eucalyptus capsules to add to the steamer. This will help for reducing the congestion. Taking steam once in a day or probably twice in a day is good, but taking more number of times could have diverse effects. It is very important to know when to seek medical help in home isolation. Look for emergency warning signs for COVID-19. If someone is showing any of these signs, seek medical care immediately. If the patient is having trouble breathing, his or her pulse oximeter reading has gone below 92, or there is persistent pain or pressure in the chest. If the patient is in the state of confusion or having difficulty to stay awake, or there is paleness, grey or blue color discoloration in the skin, lips or in the nails. If you have any of these symptoms, please call your doctor or the COVID helpline immediately. As a caretaker, it's important for you to take care of your health while sharing space with COVID patient. One should wear the mask all the time while interacting with the patient and keep at least 6 feet distance between you and the patient all the time. Ask the patient to put on the mask before entering the room. Wear gloves when you touch or have contact with the COVID patient. Throw away the gloves into a separate trash can with garbage bag and wash your hands immediately. Frequently clean and disinfect the surfaces. Even the patient room should be kept clean and disinfected. Clean your hands often with soap and water only. Use alcohol-based sanitizer only if the water is unavailable. Avoid touching your eyes, nose, and mouth frequently. Avoid sharing personal items with the patient. Use mobile phones to communicate with the patient and monitoring their health. It's important to build the confidence in the patient. Your emotional support is as important as medication. Last point I want to mention before closing is who can't be the caregiver. All can't be the caretakers. The caretaker should not be someone who is suffering from any chronic illness. If possible, pregnant ladies, diabetics, people suffering from asthma should not be the caregivers as they are at risk. In the next video of treating COVID-19 patients at home series, I will be talking about vaccination. Why is it important to take vaccination? Is there any side effects of vaccination? Different types of vaccination? How to avoid the fake vaccination? Who should not take vaccination? And many more such topics. So please stay tuned. If you have not yet subscribed to my channel, don't forget to subscribe and hit the bell icon to get notifications on the new video updates. Click the like button if you like the video. Please share your thoughts in the comment section below. Please wear your mask and avoid crowded places and take your vaccination as soon as you can. Eat healthy, stay healthy. I'll see you in my next video.